My name is Cedric Jackson, and I'm a nurse practitioner student. And today I'll be performing a neurological exam, as well as assessing the cranial nerves. This is my patient here. Could you please state your name and date of birth for me?
Tori Jackson, 5/15/88.
Uh, could you also tell me your race?
African American.
Also the gender that you prefer?
Female.
All right. Could you tell me today's date?
10/20/20.
Okay. And could you also tell me what are we going to be doing here today?
An exam.
Okay, and you know where you are?
In the clinic.
Okay, good. So I assess my patient's level of consciousness that she appears to be awake and alert. Also, I've assessed her orientation. She is oriented to person, place, time, and she is aware of the event. Her speech is coherent. I'm also going to give you three words I want you to remember towards the end of this exam, okay? They are Cadillac, pink, and zebra. Could you repeat that for me?
Cadillac, pink, zebra.
And we'll assess that a little later, okay? Also, just assessing your judgment and reasoning. Could you tell me what does apple and orange have? What do they have in common?
They're both fruit.
Okay. What about a doctor and a nurse?
Healthcare providers.
Okay.
Workers.
Good. Now, if say if your neighbor's house was on fire, what would you do?
Call 911.
Okay, good. So her judgment and reasoning do appear to be intact. So from there, I will go on to assess the cranial nerves. I'll start with cranial nerve 1, which is olfactory. Assessing olfactory, I would use alcohol prep. I would have the patient include one of her nostrils as she withstands the aroma from the alcohol prep in one nostril, and see if she's able to smell it. And also, I would then have her include the other nostril and do the same thing with the alcohol prep, and she's able to smell it. And if she is able to smell it in both nares, I wouldn't be concerned about any airway obstruction or any type of deficit that's affecting that nerve. Next, I would assess cranial nerve 2, which is her optic nerve. I would do this first by assessing her using the Snellen chart here and just assessing her vision. So in a clinical situation, I'm using a pocket guide. I will make sure that I'm 6 feet away from the patient. I will find a line on the chart, and I will ask you to cover your right eye for me. And could you read, let's say this line?
LTFPH.
Okay. Could you cover your left eye and read that line for me?
LTFPH.
Okay. And could you read it with both eyes open?
LTFPH.
Okay, great. So next on the assessment of the optic cranial nerve, I would do a fundoscopic exam. I would go in and assessing her the cornea. I would do this by assessing her right eye. I'm going to make sure I have the fundoscope in my right hand and use my right eye to do assessment. So if you would just kind of look forward for me. And so I would take the light here and I would look for the red eye reflex. And once I find it, I'll come in a little closer. And as I do that, I would be assessing the disc and the cup ratio. I'm also assessing the vessels of the eye, looking for any abnormalities, and everything looks fine here. So then I will go in to assess her left eye, again using my left hand and my left eye. I'll have you look straight ahead again over my shoulder. And I will find the red light reflex. And once that's found, again I will go in a little closer. Once again, assessing the disc and cup ratio. Also assess the vessels of her eye. Looking for any abnormalities. And then her left eye is fine as well. While I'm here, I will also assess her pupillary response to light. So I'm going to do this both consensually as well as I'm just both consensually as well as directly. So I'm gonna take the light here and slowly shine across your eye. Just making sure her pupils contract. So that's direct. You know, I'm gonna use a pen light. And doing so, I'm past assessing. This is really assessing her cranial nerve 3, which is oculomotor, when you're assessing her pupillary response. So I will go into while I'm here, I'll go ahead and assess that here. Just assessing directly and also consensually, making sure both eyes constrict at that face you like. So I'll do her left eye. Direct. And I'm also doing it consensually. Good. And both her eyes do constrict, so her pupils are equal, round, and reactive to light bilaterally. Again, that's assessing oculomotor, which we'll get to next. But going back to the optic cranial nerve, I'm going to assess her peripheral vision here. So I'm gonna put my hands behind you and you just look straight ahead. Try not to move your head and you tell me when you're able to see my fingers.
Now.
Okay, good. So again, that's assessing assessing her cranial nerve 2, which is optic. Going back to cranial nerve 3, which is oculomotor. In doing so, I'm going to also assess cranial nerve 3, cranial nerve 4, which is trochlear, and also cranial nerve 6, which is abducens. That's going to check in her 6 cardinal signs of gaze. So I'm going to have you to follow my finger. So we'll check her eye movement, and you just follow my finger with your eyes. Don't move your head, okay? Laterally, and while I'm checking laterally, I'm also assessing for nystagmus, which is quick eye movement, and she does not have any there. So we've assessed our cranial nerves 1, 2, 3, 4, and 6. I will now assess cranial nerve 5, which is trigeminal, and that's checking sensation on your face. So what I'm going to do is have you close your eyes and look straight ahead, and you tell me whether the object is soft or sharp.
So. Sharp.
Upside.
Sharp.
Okay. Good. And I'm also going to assess your the motor function there of cranial nerve 5. So I'm just going to have you open and close your mouth for me, and then kind of move your side to side. Great. So perfect. Things to take there. So next we'll assess cranial nerve 7, which is facial. So we'll assess the upper and the lower. So if you could do a surprise face for me, like raise your eyebrows. And could you also puff out your cheeks for me? Good. Okay. So that's again assessing the facial cranial nerve. So let me just check here, make sure we're going in the right order. All right, so next we'll assess cranial nerve 8, which is acoustic. This is assessing her hearing and conduction. I do perform a couple tests. First, I would going to use a tuning fork, which this is the Ryan's test. I'll hit the tuning fork. We'll place it behind your ear on both sides on the mastoid bone there, and I want you to tell me when you stop, when you're no longer able to hear the sound when I have it on the bone there, and then we'll place it in front of your ear and see if you're able to hear it still. Okay. So first, I'll start with doing that. We'll find the mastoid bone. I will get the tuning fork going here. Mastoid bone. I'm sorry. Tell me when you're no longer able to hear. Can't hear?
No.
What about now? Okay, good. So we'll check the other side as well. Okay, good. And those are normal findings. You would expect her to be able to hear it after she's not able to hear it on the mastoid bone because air conduction is lasts longer in air than it does on, say, like a solid material like bone. So next is going to be the Weber's test. I'm going to place this on your forehead, and you just tell me which side you hear the sound better on, okay? Hear better on your left or right?
The same.
The same, good. And you would expect to hear it on both sides. If she was able to hear it on her right side more so than the left, you'd be concerned about hearing loss there. So next is I'll perform a whisper test, which I'm going to have you close one ear, and I'm going to whisper a word in this ear, and you tell me what that word is, and I'll do the same on the other. Okay. In the clinical situation, I will go behind the patient and whisper these words in her ear. So yes, clue that ear, perfect.
Apple.
Okay. Did you hear that?
I did not. Beach ball.
Good. So she was able to hear past the whisper test there. So that's cranial nerve 8, which is auditory. Cranial nerve 9, which is cranial nerve 9 and 10, which is glossopharyngeal and vagal. I'll have the patient first. I will have her say for me as I look back. And I'm just assessing her uvula, making sure it's midline. Perfect, thank you. And could you also take your tongue and press it like on the side of your cheek? Other side? Perfect. So that's a good assessment there. So then I would assess cranial nerve 11, which is cranial 11, which is spinal accessory. So what I would want you to do is I want you to shrug your shoulders, like I want you to shrug your shoulders. I'm going to try to push down on them as you shrug them. Okay, so raise your shoulders. Okay, good resistance there. So also I'm going to have you turn your head this way to the left, and then I want you to try to push it against my hand here. Good. Now turn it to the right. Now turn it like you're going to push my hand away. Perfect. Good. So then next I would assess cranial nerve 12, which is hyperglossal, the cranial nerve, but kind of assists that when I had her say ah, and also so going back to cranial nerve 9 and 10, just want to make sure you can stick your tongue out for me, perfect, and also I just want to use go ah and swallow like you're gonna swallow. Just open your mouth and like you're gonna swallow. Just your head back for me a little bit, and just like you're swallowing now, good. Okay. Next, which the patient I'm coming in, I did watch the patient walk in, just assessing her gait when she was coming in. But now I'm gonna have her do a few things. So I'm gonna get close to the camera so we could see her do these movements. So if you would stand for me and walk a couple feet, just walk a couple feet, just normal. Okay, turn around, come back. Okay, good. So next, what I want you to do is, I want you to do like a little heel toe. So you put your feet straight ahead and then you put your, yes, just like that. So a couple steps just like that. Good. So stop right there. And what I want you to do is come walk back towards the exam table on your tiptoes. Good. Now, could you take a few steps forward on your heels? Okay, perfect. Now, while we're standing here, let me adjust the camera here. I want you to place your palms out in front of you, your hands stretched out in front of you with your palms up. And I want you to close your eyes. And I'm just assessing, seeing if she's drifting or has any type of drift. We're standing with her eyes closed. Okay, so open your eyes. So now what I'm going to do is have you close your eyes, and I'm going to push down your hands, and I don't want you to try to, stay in that position as best you can. Okay. And that's what we expect. We expect your hands to kind of go back to the normal position. Okay. So you can have a seat for me back on the table here. So the test that we were performing there was the Romberg test with her hands facing up. Make sure she wasn't drifting. And also the pronator drift for placing her hands down. Try to put the hand down quickly and see if those hands return to the normal placement there. So next, what we're gonna do is check for sensation. I'm gonna have you close your eyes. I'm gonna place this couple of places on you, and I want you to tell me if you feel 1 point or 2 points.
1, 2, 1, 2.
Okay, good. All right. So I'm gonna place something in your hand here. I want you to close your eyes and open your hand. I'm just gonna place it in this hand. I want you to close it, and you tell me if you can tell me what that is.
Cotton swab.
Okay.
A Q-tip.
Okay. Good. Good. So that is steroidogenesis, steroidognosis. And that's just where she's able to identify an object that's in her hand without a common object in her hand without looking here. Okay. So I'm going to check the sensation in your upper and lower extremities here. I want you to tell me if what I'm doing is soft or sharp. Okay. So if you would close your eyes.
Soft. Sharp. Soft.
Okay.
Foul. Sharp. Foul. Sharp.
Okay. Great. All right. And if you could remove your shoes for me. Okay. I'm just gonna use the tuning fork and see if you're able to feel sensation in your feet here. So I want you to just close your eyes for me. I'm gonna use your big toe as a.
Mm-hmm. 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 Yes. Yes.
Okay. Good. Also, now I'm going to test the muscle strength in your upper and lower extremities. So this is just checking the big muscles of like your deltoid, your triceps, and your biceps. So what I want you to do, I want you to put your fist out in front of me, or hands out in front of me, and open your fingers. And I'm going to try to close those fingers. You just keep them open. So good. I do feel some resistance. So I want you to ball your fist. I'm going to try to force your fist down, and you work against me, okay? Good, good. So pull your shoulders back, elbows in. So what I'm going to try to do is push down again. You work against me, okay? Okay? Now push towards that. Okay, good. All right. So also I'm going to have you hold your arms out, straight out. You work against me as I push down, okay? Good. Push. Okay, good. Pull your arms in again. So I want you to try to push out against my hand with your elbow. Okay, this side again. I'm doing both at the same time. Okay, so they are equal bilateral in here. Also, hold your elbows out like this. Kind of bend forward. Now I want you to kind of press them in toward against my hand here. Okay, good. One more time. Good. So good strength in your upper extremities. So I'm gonna do the same thing with your lower extremities. This is checking the muscles in your lower extremities. Again, I'm gonna push out towards me. Good. All right, now push my hands down like pressing. Okay, good. Gas pedal, pull them up towards you. Okay, great. So good strength there, bilateral here. That's again checking the muscles in the quads and hamstrings and all there. So now I'm going to check the strength of your hips. So it's going to be real quick. If you could just lie back for me, put your head this way for me, okay? Just real quick. Okay. So what I'm going to do is I want to try to pull your legs apart. I want you to hold them for me. Like, I want you to try to stop me from pulling them apart. Okay? Now open your legs a little bit for me. Now I'm going to try to close them. I want you to work against me. Okay? Good. So now I'm just going to kind of internally rotate your hip there. And you just kind of push back towards against me. Okay, good. Now in. Okay, good. Also, do the same thing with this side. Push. Okay. And good. Good. Perfect. So you can sit up for me. So I would say her strength is like a 5 out of 5 in both her upper and lower extremities here. So lastly, what we're gonna do is gonna check your reflexes. We'll take your brachial reflex. Also, we'll check your patellar reflex, your Achilles reflex, and your tricep reflex. Okay. So first we'll do your bicep here. Good. So then we'll do the tricep, which is kind of hard to, because you have to be really relaxed to get this done. Just feel relaxed. Let's see here. Okay, I see just a little movement here. Okay. So I'm doing the same thing on this side. Just checking your bicep tendon.
That is weird.
Next, I'm gonna check your triceps. Felt weird. Okay. You're just gonna have to really relax. Okay. Okay. Good. Now your brachial. Looking for a little thumb twitching out here. It seems to be present there. So next I'm going to check your patella reflex. So control your legs down and just kind of relax them there. Good. Okay. Now Achilles, see it a little. And do the same for this side. All right. So, also I would say her reflexes, they're not they're not hyper, so maybe like a plus 2 or 3 on her reflex response, especially on her lower extremities, maybe a plus 3 up top and all those, check in all those areas. Next, I'm going to check your plantar reflex. So if you could slide back on the table for me. So I'll just use this tongue depressor here. You're real ticklish, I'm sorry. Okay, good. That's good there. So what we're checking at is making sure she's not having like a Babinski response, because that's more so for a newborn, and you wouldn't expect that would be an abnormal finding in an adult. So I'm just gonna look over my notes just to make sure we did a thorough assessment here, to make sure we checked everything before we send you home. All right. So it does look like we've assessed everything. So did you have any questions or concerns about this exam today?
I do not.
Okay, well, I do appreciate your time. Thank you.
You.